Meantime, let's bring in the Health Secretary, Steve Barclay. Good morning. It's great to see you, as always. Thanks for joining us on the programme, just hearing what's happening there at the Paris-Gare du Nord airport. Keep saying airport, train station. How concerned are you about what we've heard about what's happening at Heathrow Airport as well? We heard that there was some material that anti-terror police were involved in, and I don't know what's happening.
Well, I'm obviously learning about this this morning, and clearly there's an investigation underway, and it's right that that looks at all the issues, and I'm sure it will report in due course.
OK. It's obviously very alarming for a lot of people this morning, but as you say, information still coming in on that. What we can say in other matters, particularly as far as your brief is concerned, 50,000 more deaths in the NHS over the past 12 months. Why is that?
Well, all countries are looking across Europe, facing a similar issue is what is the consequence of the pandemic. Clearly, during the pandemic, there will be some patients who delayed treatment. Particularly, we're seeing some of that play through in pressure on cardiovascular conditions. There'll be some directly linked, some of those deaths, to COVID itself. Some of it may be indirectly where, for example, someone's waiting for treatment. We've got a challenge in terms of people waiting for operations that we're working very actively to clear. So it's extremely complicated as to what the driver of those excess deaths are. That's something we're looking closely. I'm talking to the Chief Medical Officer.
How alarmed are you by those numbers?
Well, it's clearly concerning, but it's not something that's just affecting us in England. It's something
I know, but
all
nevertheless,
countries...
50,000 people dead who perhaps wouldn't have been otherwise. You must be alarmed by that.
Well, it's concerning that there are those, but clearly we knew at the time of the pandemic that in order to prevent further deaths as a result of COVID, we needed to take a whole range of very severe actions, and those had an impact. Those had an impact in further waits for operations. They had an impact in patients who didn't get treatment at the time. Now, we've got a recovery plan in place. We cleared the longest waits, the 2-year waits, over the summer. We're now focused on the 78-week waits and working on those to get those down. So we've invested more in the autumn statement, an extra £6.6 billion into the NHS to clear those backlogs. But obviously that will take time.
The ambulance workers on strike again today. Your colleague Grant Shapps saying striking paramedics are risking lives. Do you agree with him?
Well, if there's delays to ambulances, obviously it is concerning in terms of our ability to that care. But we've been working with the unions constructively on what cover they will put in place. I'm very pleased that we have cover from the unions.
Are they risking lives by going on strike?
Well, it's clearly a concern in terms of the impact that it has on patient safety, but we're working constructively with the unions in terms of particularly for life-threatening calls, those most urgent 999 calls, and what we're saying to the public is where there is a genuine life-threatening urgency, the most important Category 1 calls are being covered, but clearly there'll be wider pressure on the ambulance system today. So we're saying to people to be mindful of that, but if they do have a life-threatening condition, the most urgent Category 1 calls are covered today.
OK, GMB union, I had them on the show just a few moments ago while you were speaking to some of our colleagues at other outlets, and they're saying these talks that you've been holding have been pointless.
No, I think even if I take Sarah Gorton, who's the head of the NHS Staff Council, she said after the talks that I had with them on Monday that there had been progress. I'm seeing the Doctors' Union today to have discussions with them. We believe, Kay, that the right approach is to have the independent pay review body look at these issues in terms of what is...
The pay review body is not independent, is it?
But it is independent, and even the opposition...
The chair of the independent pay review body is chosen by the Prime Minister, and ministers choose other people within that peer review body, so it's not independent.
Well, even the opposition recognise that Labour have said that they themselves support an independent pay review body process. That's something that governments of different colours have had successively for many years. It's able to look at these issues in the round, but we're working constructively with the unions to see what further things that we can do. That's why we had the discussions on Monday, because we want to get the evidence for this coming year's pay review body to reflect the pressures that the system are under, and that's what we were discussing with them on Monday.
I've told you what the GMB has said this morning. The head of the national lead for Unite saying that you only wanted to talk about productivity. Do you think that NHS workers should work harder to get a pay rise?
Well, productivity is not about working harder. It's about getting the system as a whole to work better. It's about, for example, the investment in technology. It's about enabling people who have had training to be focused on what that training is best for, rather than, for example, many of their frustrations with some of the administration, some of the bureaucracy, some of the things in the system that are not working as they should. And actually, that's common ground with the trade unions. The trade unions say to me often they are frustrated on behalf of their members with some of the inefficiencies in the system. So it's right that we look at where can we work smarter, better, in a more effective way. What is the right investment in technology? What is the cost of agents at the moment, and can we look at how we bring that down? So there are areas we can work together with the trade unions on that and use that to make any pay review body settlement more affordable in April.
General Secretary of the TUC, Paul Novak, saying that the anti-strike laws that you want to bring in are undemocratic. What will happen if workers just ignore these laws and strike anyway?
Well, they say it's undemocratic, but lots of other European countries have them. And I don't hear them saying that France is undemocratic.
What will you do, though, if people don't, if people ignore, break the law, basically, and go on strike? Well,
firstly, what I'm saying is lots of other European countries have these. So when people say it's undemocratic, it is something that they have in France, they have in Italy, they have in Spain. And I don't think anyone's seriously suggesting these countries are undemocratic. But what we're saying is, if we look at the way the RCN have approached national arrangements for the strikes, they've acted very responsibly, to be fair to them, in terms of having a national arrangement in place.
But as far as my question is concerned, we only have a limited amount of time, Mr Barclay, as you know. What will you do if workers break the law and go on strike?
Well, this is about having a safety net there, as they do in other European countries, to ensure that there are minimum safety levels, minimum service levels in place. We will debate this in Parliament in terms of how this will apply. We're just looking at ambulances in the first instance in terms of health.
People, are they, if they break the law and go on strike? You're just not going to prosecute them.
It's about the behaviour much more of the unions. It's about the behaviour of the unions more than individual members. So, for example, there's a marked difference between what we've seen with the RCN, who have had national arrangements in place to guarantee safety, and what we've seen with the ambulance strikes, where even up to midnight last night, I was getting calls in terms of what arrangements would be in place, in terms of the local cover, the minimum safety levels that would be in place, because the ambulance unions have refused to do that at a national level. And my concern is patient safety. That is what...
No, I understand, but my question is, how will you implement this law? If people go on strike and it's against the law, breaking the law, what will you do? Well,
as they do in other European countries, it's about having a safety net that applies to the behaviour of the trade unions.
But what are you going to do if they break the law?
We're going to debate this. It'll probably take about 6 months in Parliament for the legislation to pass, so this will be scrutinised. We will debate this in Parliament. But it's about saying we want to be in a position to have national minimum safety levels in place, just as they do in France, in Spain, in Italy.
Will you accept that the NHS is on its knees on your watch?
Well, it's under huge pressure, but that's not just in England. If you look at what the First Minister said on Monday, Scottish hospitals are near completely full. If you look at Wales, more than 50,000 people waiting more than 2 years for an operation. If you look at my counterpart in France, he said that...
So what? I mean, it's people in England who you represent, and they feel that the NHS is on its knees. Do you acknowledge that?
The NHS is under huge pressure, and I acknowledge that in the House of Commons
more than
on Monday.
It's been previously?
Well, more so because of the pandemic, because of the combination of the delayed discharge, the people in hospital who are fit to leave and have been delayed. We recognise that with the extra funding we're putting in place in the autumn statement. On top of that, you've got around 9,000 people, over 9,000 people in hospital with COVID. And then we had this massive surge, as they did across Europe with flu cases over Christmas, a 7-fold increase compared to November. There's 100 times more patients in hospital with flu this year compared to last year. Yes, I've had both. And if I could make one plea to any members, we've extended the number of people that can have access to the jab. And if there's any of your viewers, particularly over 50 or in the cohorts that are at risk who haven't had their vaccination, if I can make a plea, Kay, for them to do so.
Are you looking at me?
I'm saying anyone who's not had their jab who is watching this, if I could urge them to do so.
Well, when I get to 50, I might do it. Thanks very much. It's good to see you as always. Thanks very much indeed. Thanks for joining us.